everybody, it's Matt and Dyan. Welcome back to OK Aussie. It is Sunday the 18th of May. Current time is 5:34 p.m. Dyan has just started saying that she's feeling so much pain. She stood up for a brief second, clicked her back because she's out in a couple of locations, and then she's suddenly gone quiet, and we know that she doesn't go quiet. She never does quiet, really. If you're new to the channel, welcome. Dyan's got a chromosomal genetic condition, 22q11.2DS deletion syndrome. That's where she's missing 30 to 50 genes, 3 million DNA building block, and because of that, she is a high-risk patient because of 180 plus different possible symptoms clinically that she can get. She has many different types of seizures, as do many people with 22q. In fact, 65% of them will have seizure or seizure-like conditions. Just putting some pulse oximetry on so we can monitor where her heart rate and oxygen output is actually starting to get a little bit low. No surprise there. Alright, got the device up and going already. 93% oxygen, 52%, 51 beats per minute heart rate. Quite likely that Dyan will go into some sort of seizure. It's 24 degrees outside in sunny old Perth. Yeah, it's 25.6. Dyan's been running fevers today. So 37.6 degrees, 37.5 is where we get the start of the febrile seizures. She's doing just above that, 37.6, and with that she's had a couple of Panadol Osteo throughout the course of the day to bring her temperature down. Heart rate is at 52, oxygen stats are flapping around about 94% saturation. We have a medical oxygen concentrator device. When levels of oxygen go to about 90%, then we engage that to provide supplementary oxygen to help Dyan breathe in case she's in dystonia or seizure, or in case her body's just not managing things in general. As Dyan's not standing upright or walking around, we're not going to put a crash helmet on her, so we're not worried about that from the perspective of atonic seizures. Because she is flopped, literally in a syncope, passed out position, I'm just going to reduce the legs down. I want her, because she's turned out, dislocating her hips, high likelihood and high risk of that because of her Ehlers-Danlos hypermobility with her condition. The 22q creates all of these. It's an umbrella term affecting so many different parts. That's why she's autistic, ADHD, OCD, Tourette's, the seizures, musculoskeletal systems, hypermobility, cardiac, respiratory related issues. Hello, boo. Your pulse rate has just gone down to 49. Let's get some audible alerts up so we can now monitor what you're doing. Do you have any chest pain at all, Dyan? Head pain. It's alright. We'll get you. Just going to give you some medicinal CBD. 0.5 mils, open up, buccal, 0.5 mils, CBD, THC, heart rate's just dropping down to 48, oxygen's at 97, heart rate's at 47, just going to syncope, it's 5:38. The alarm's set to certain thresholds. We've got a threshold set to 90% for oxygen. So if oxygen saturations go below that, I'll apply supplementary oxygen. If the heart rate, and this is the first level heart rate warning, is at the 50 beats, we quite commonly will go down into the 40s and below into the 30s, mid-30s. It's okay. It's 5:39 p.m. So the Panadol Osteo has managed to bring down the temperature. So from originally 37.6, it's now down to 37.1. That alarm that you're hearing is the heart rate alarms. Oxygen levels seem good at the moment. Okay. hot pack is off. She's been using her hot pack behind her back, obviously with any spasms or muscle pain. Just going to take that off so it doesn't impede. She's going into some dystonia. I can see with the left hand. Right hand's fine. Feet are fine. Blood pressure 101/64. Pulse at 48. Dyan's baseline is 80/65. You shivering or are you cold? Okay. Circulation's fine in the feet. Blanch response is fine in the feet. Just going into a bit of dystonia, we need to get you into some Clonazepam. Heart rate is at 47. This are the ticks, 541. Down. Heart rate's just flapping at the moment. Seeing oromandibular dystonia coming through my face. So the oromandibular is part of the segmented cranial dystonia that Dyan can get. So she can have the segmented cranial dystonia in the face. This is where the mouth muscles, oromandibular, blepharospasm around in the eyes. You can see the tics coming through in the upper version, and tonic-clonic seizure. Okay. Current time is 5:41. Okay, fixation in that. Let's worry about the head first. So, okay. Making sure that we've got breathing. There we go. Reduce stiffness, get the socks off. So we might get some short in and out tonic-clonic seizures. If we go on multiple subsets, then that's a status epileptus. We're mindful of times. So we'll keep an eye on frequency, severity. Normal medications have been applied today, so there's no issues about the amount or types of medications. Hey, gorgeous. Just had a seizure. Just going to keep an eye on you. No. Yeah, okay, that's good. Don't mind you rolling over. Fatigue and being signs of tiredness during seizures and post seizures are very common. Dyan's already got a fatiguing condition. Heart rate's accelerated up with the tonic-clonic seizure up to 60. And then it's sudden drop down. So you can see what we're getting. The spike was up to 60 with the tonic-clonic seizure, and now it's suddenly dropping back down. Oxygen stats is still good, so I'm not applying supplementary oxygen. It's okay. Secondary, 543, tonic-clonic seizure still. So up. Okay. Slowly breathing down. Okay. Oxygen stats are dropping now, 95, 94, 93, just keeping an eye. If it hits 90, that's heart rate alerts coming in at 49. Come on, big girl. You have been doing so well. Trying so hard. Dyan's had a lot of pain to deal with lately. She's also had 2 activities today. That is very subdued. First activity was a visit from my sister where she's literally stayed in bed the entire time, but it's a social interaction for about 45 minutes to an hour. Second was a social interaction downstairs, again for about an hour duration with some of the disability neighbours in the complex. Subdued ticking, 5:44. .47 is the heart rate. Oxygen stats are good at 97, so again I'm not applying supplementing oxygen until they hit threshold levels. Can't discern the alarm, so we have to check every alarm for what it is. Alarms can overlap. Right eye is fully closed because of the blepharospasm. Left eye is open at half mast. You cold? Okay. Keep you warm in between all this, eh? Are you going? Can you swallow for me? I need to get some medications into Boo. I need you to have some medications. Okay, let's do that, eh? Just sitting up a little bit. 3 medications. Yep, I'll give you the first. Here we go.
No.
Just don't. Just take. No, you need that, darling. You need that. The sodium valproate. It's your normal time, darling. It's your normal time. Okay? It's your normal time. Don't have a confusion around this. I need to get in quickly before she goes out again or have another seizure. Sodium valproate, Clonazepam, and Gabapentin. 3 tablets. Good girl. Looking for drops, making sure she can get it in. Water is provided. Come on back. Careful with the dysphagia. Swallow through. Okay, watch for dribble. Good girl, that's okay. Here's the water. It's very hard to find a window of opportunity in between seizures or dystonia. You'll see that the right eye is pretty much almost fully closed. Left eye is open by a few degrees more. This is the blepharospasm that affects eyelids. Good girl. Sitting up causes orthostatic intolerance. That's why her heart rate's just peaked up to 73 beats and now dropping back down. Oxygen stats are at 94. So you can follow along with me. When we have orthostatic tolerance when she's sitting up, you're getting now the blepharospasm in the face. Okay. I'm going to take you down. Just in case you roll or do anything strange. Heart rate's 48. Oxygen stats 98. I'm right here, gorgeous. So, as I was saying, 2 activities today, 2 things. 2 social engagements. First one in bed. Second one in a wheelchair, just downstairs. Only 1 person. So this is why we do the graphical information, so we can see the spikes, the peaks and the troughs in alignment with either tonic-clonic seizures, where the heart rate will spike up, orthostatic intolerance, where posturally, when she's in an upright position, it affects heart rate and blood pressure. Chest pain? Nitrolingual spray. Hey Google, set timer. 5 minutes. 5 minutes.
Got it.
5:47. GTN spray applied. 5-minute timer set. If it's not reduced after 5 minutes, then we'll apply a secondary secondary spray of GTN. Hey Maxie. We've got our cats. Willow. Maximus. Let's keep an eye on her. And the chest pain. It's okay. I need to be able to see your legs, sweetie. I'm just going to be able to see your stats. Slow your breathing rhythm down. I know you're in pain. I want you to slow your respiratory rate down. Big breaths in. Clicking action. Right eye is fully closed. Right eyelid is in a droop with a pulsing, so we've got some facial neuropathy happening. You see the jaw thrusting coming out here to this side. There'll be a bit of teeth grinding with the bruxism that goes with this as well. You can see both eyes all controlled by the blepharospasm. Okay, that's why the eyebrows will do that action as well. Hand over here for me is still indications of chest pain, so we're monitoring that. Hence why we're using Google Home Automation with a timer, and we'll apply more GTN spray if need be. She's already had several Clonic Seizures in this. This is heart rate. Oxygen stats are at 94. Just applying a bluey pad. Current time, 5:49 p.m. Oxygen stats just crashing out. 88. Okay, sweetie. I'm just going to give you some oxygen to help. There you go. Just going to give you some oxygen. Hello, sweetie. I'm right here. We go. This is going to bring your nipples up. Look, we'll just go. Hello. The pain is going to go away very shortly. Okay, promise you. Oxygen concentrator is at a level 2. Okay, why is the battery not working? Alright. Battery charge hasn't been plugged in properly. Battery is now plugged in properly. I have a spare battery in case it runs out. We're at 65% battery, keeping an eye on that. Maybe when the support will get plugged it in. Pulse rate's at 50, heart rate's at 96. Oxygen stats, sorry, at 96. Supplementary oxygen is helping. If I need to increase the throughput level, then I will do that. Hey, gorgeous. Was ticks, 551. So, toes flexible. Left focal dystonia in the left hand. Right focal dystonia. So you can see the curling. That's actually occurring. And now another seizure. 551. Heart rate has spiked up with the seizure, 65. Oxygen stats are steady at 96. Hello, gorgeous. Medication that we've just given, just to explain that. The nitrolingual spray, GTN spray. Hey, darling, do you have any chest pain? Relax down. No, you're okay? No chest pain?
No.
Good girl. Counselling timer, had 27 seconds left. Great. Eyes are hurting. That's okay, that's the blepharospasm, it'll ease off. It causes contractions of the muscles, so around the orbit, around the eye, the eyebrows. Hello, darling, you've just had a few seizures, you've had some dystonia. Let's just keep you warm.
Cold feet.
Cold feet, socks I can have, let's do them. It's alright. It's okay, my gorgeous girl. Temperature in the room's not that cold, it's 25.5. Actually, we should be around about 24.5 to 25. So it's not really cold. She is burning to touch, fever, like I said. She's already had some Panadol Osteo this afternoon, which has brought her temperature down. She's going into a cranial dystonia, so tilt to the left, the oromandibular dystonia in the jaw. Hey, gorgeous, you're not having much fun.
No.
It's okay, neck will be hurting because of that. I know, the cranial dystonia, which tilts your head to a locked position to the side, is going to hurt your neck. Dyan's already got CCO, cranial cervical instability. I can't put a neck brace on during this period of time, so we're not going to do that. Oxygen stats are at 94%, a bit laboured with the pulse oximetry supplied through the device. I'm just going to bring that up to a level 3 to increase the oxygen saturation. I want to see levels of 97, 98% when she's on supplementaries. Another seizure, 5:54 p.m. Okay. Heart rate's at 59, spiking in conjunction with the tonic clonic quite traditionally. You can see this fixed position here. Quite commonly you'll see a spike of anywhere between 15 to 20 beats per minute in the tonic clonic seizures. Just applying midazolam, getting that ready for an emergency med, because it looks like we might be having to apply that. I'm going to go with a soft ampule rather than actually break a glass ampule of midazolam. So we'll use midazolam 5 ml as an emergency med to break. Oxygen stats are improving, 97 and 98%, though getting a drop off. What's going on? Come on, 91% and you're on supplementary. Come on. Come on, my girl. Hello. Even with the supplementary oxygen, you can see that we're getting these drop-offs just down here. What I want to see is she should be up at 97, 98 because she's actually on the device and running that. Heart rate remains high because she's still going through seizures at the moment, as you can see in the face and the hands. So I was explaining what medications have been given. So Dyan's had a Gabapentin that's going to help with some of the nerve pain and bring her pain level down, just in case the pain response is actually part of the trigger, which I think it may be to this seizure. She's obviously fatigued, so I can't help the exhaustion level except to literally get her to relax and recover. You're going to feel sick coming up. Sick bag. On Danzatron, I'm getting... No worries. Alright, 4 milligram on Danzatron, sublingual wafer, 5:57. That'll just melt in her mouth under her tongue and that will help her with her nausea. The dystonia, which is those muscle contractions that you've seen in the face, you've seen focalized dystonia in the hands. The dystonia is also going to be affecting her upper torso. So it's going to be affecting things like the stomach, abdominal muscles, abdominis rectus. It's going to be getting into things like the intercostal muscles. It will be affecting things like the diaphragm. So that's why we've got to be very careful around the breathing and the swallowing ability. You can still see it fully engaged in the pursing, the chin, the jaw, that's the oromandibular, and around the eyes. Pulse rate's increased up to 72 because she's just going through seizures, 5:57 p.m. It's 25.2 degrees in the room, so it's a perfect temperature.
Yeah.
Alright, Dyan, I need to give you some medication, sweetie.
No.
Yeah, I know you're going to say no.
No, no.
Yeah, I know you're going to say no. But you don't get a say in this one, kitten. I have to make medication decisions as we go along. This is why I'm also Dyan's health guardian. Oxygen stats dropping out, 89, and she's on level 3 of medical. Okay, Midaz, 5 mils oral buccal, 5:58. It's okay. Hey Google, set timer 10 minutes. Now the midazolam is a fast-acting medication. It should see results within 10 minutes for Dyan. We should actually see a reduction in subduing of the seizures. I know, it tastes like shit. I know, I get it. Yeah, I'm going to sit you up a little bit. It is yuckies, I know, kiddo. I know it is yuckies, I'm sorry. They should have nice emergency medications. So the previous medications, just to clarify, Gabapentin 300 milligrams, Syncope 5:58. Come back here with your head, kid. So Gabapentin 300 milligrams. The Ondansetron 2 milligrams is a muscle relaxant commonly we use as a AESM anti-seizure medication for the dystonia. Oxygen is dropping down 87% and on supplementary oxygen. Now we really do need proper oxygen. Seizure 5:58. Clonic seizure. You can see the tension coming through this upper torso. You can see the whole contractions. I'm having difficulties with her breathing. Come over here. Come down, girlfriend. Okay, that's my girl. There we go. You're gonna be okay. This silly thing's gonna pass and you're gonna be perfectly fine. Let's just get it away. Just gonna bring her hair. One of the problems with long hair is actually managing it during these sort of things. So just bringing her long hair at the top so it's out of the way. I'm very cautious about putting her and keeping her in a recovery position, obviously because of the instability around the neck. So we've got to be careful of all these joints. It's okay, we can come back to it. It's okay. Dyan's right eye is fully closed, left eye is half engaged. She's feeling my face. I'm right here, you know that. I've got you. I've got you, my gorgeous. I can't get to the device. Oxygen is 92, heart rate is 48. Heart rate's obviously come back into range. So the medications that we've given have also included a sodium Valproate, 200 milligrams. That's a top-up dose. It's not an anti-seizure medication. It's not going to suddenly, there's an emergency, stop the medication or stop the seizure from occurring. But it's going to top her levels up so that we can hopefully break out of a status epileptus, which will be these rolling seizures that don't seem to be giving her a break at the moment. 6 o'clock. Feet are fine. There's no focalized dystonia there. Hands. We have mild fixation in the left. Right has been released. We have got over the face. Still right eyelid. Left eye's at half mast. These are the stats that I'm getting on supplementary oxygen, 81, 79%. Getting really stupid now. Heart rate is at 50, so that's great. I'm happy that's stabilized. Oxygen's dropping down 77. Alright, no kink alerts in the alarm. You're getting oxygen through. I'm increasing oxygen saturation levels on the machine to 4. We're at 84, 85. You can see the results as we're going down in here. Okay, good gal, nice one. Okay, dystonia I'm hoping is releasing coming out of that. Oxygen levels are coming up at 87, heart rate's at 54, 88 on the oxygen. Come on, let me see some respiration. Yep. That's cute, thank you. Maxie, you're not helping, dude. So, and back seizure, supporting the right arm and back. Okay. Ouch. Fuck off to that. Good boy, Max. Good girl. All alarms are coming out. 96% on oxygen. Heart rate's at 49, 48. Hello, hello. Hello. I'm right here. I'm right here. Hello. It's okay. I've got you. I have honestly got you. The medications are kicking in. We've got 5 minutes countdown. 5 minutes and these stupid things are going to stop, okay? The medications I've given you are going to help you. Okay? 5 more minutes. It's alright. So the midazolam will work. Dyan feels sick, she wants to sit up, no problems. Happy for you to do so. You want your pillow? No worries. Got to be very careful of patellar dislocation and or hip dislocation during this. Heart rate's dropping down 46, oxygen stats are at 91, 90. About to get 2 sets of alarms as the oxygen drops out. Come on. Though the oxygen concentrator is good, oxygen cylinders will be better, getting a higher degree of pure oxygen through, and will be substantially helping her levels. Oxygen saturations are at 87%, heart rate's at 49%. I've got almost 4 minutes left on the timer for the midazolam to work. Ticking and seizing, 6:04. Come on, Midaz, you can do it. 88% on the oxygen, heart rate's at 50. Heart rate will increase obviously because of going through these seizures. It's alright, Tony. Obviously having to watch and wait, keeping a very close eye on Dyan, making sure that she doesn't choke, making sure that she is getting enough oxygen in, keeping an eye on her respiration levels. 96% oxygen at the moment, 95. Heart rate's at 52. Okay, cognizance, 6:04. Bringing up the head of the bed will increase her blood pressure and heart rate a little bit, which is what I want. Oxygen sets are at 92. On your left hand side, this side. Good go. I need the readings. You're fluffing around with my settings and I need them. It's not your fault. It's okay. I need to see where you're at. Okay, levels are back. Good girl. Dyan can sometimes bump her devices, so keeping an eye on those. Back on 97% for oxygen. I'm going to bring down the concentrator. I've come down from 4 to 2. She's maintaining 97%. We'll keep an eye on her oxygen stats. Hey, gorgeous. Hello. Got you. Midazolam, 2 minutes and everything's going to be okay. Alright, we're coming through to it now. Oxygen saturations are still flapping around, that's like 89%, heart rate's at 52. Hello, gorgeous. Right, chest pain, any at all? No chest pain indication. Headache, migraine, any head pain? Yes, okay. We'll get to that in a moment, deal? Are you okay breathing? Okay, can you try and do some big, deep breaths? That's okay, aspiration is expected. That's it, girl. I want you to have big, deep breaths. Open up the bottom of the lungs for me. Come on. I know you're going to feel tired. I'm bringing the oxygen concentrator back up to a level 3. Heart rate is at 55. Oxygen stats are at 88% on medical oxygen. We really could do with some oxygen cylinders to get a pure form of oxygen levels into her. This is the phase where we keep an eye out for the yawns. We're going to see her body relaxing from the medications that she's been provided with, the Clonazepam, the Medicinal CBD, THC, and obviously the midazolam with Clonazepam as well. We're hoping her body is starting to relax, stopping the spasms, stopping the seizures, stopping and breaking the tonic clonics. That's the whole idea of the axial. I'm still getting blepharospasm in both eyes. Oxygen stats are at 93%, heart rate's at 52. It's currently 6:07 p.m. Hey, sweetie. It's okay. Okay, that's a Google 10-minute alert on the midazolam. That should be helping us to see that we're breaking out of clonic seizures. The Clonazepam should still be working and helping to reduce the dystonia actions. That's going to be the segmented cranial dystonia in the face. Even though we're still getting some, I'm expecting that Clonazepam works slower. Okay, so it's not going to be all immediate. What we want to do is first of all stop the tonic clonics. That's the real life-threatening one at the moment, and I feel that we're getting on top of that. And I'll bring her down about there, 30 degrees. 90% oxygen saturation has just dropped below that to 89 threshold. Heart rate's at 57. Come on. You're coming around, sweetie. Medications are going to start working. You're going to start feeling less contractions. You're going to feel a lot more relaxed in your body soon, okay? I know you don't feel good. I expect that. I'm so sorry. Yeah, we need to take blood pressure. Dyan has and is dealing with cardiac related issues, respiratory related issues, multiple seizures types, atonic, myoclonus, absence, tonic-clonic seizures, focal and focal aware seizures, whole raft of those. For dystonia, that comes from the basal ganglia, so it's a communication issue, and that's why it affects the messaging to the nerves and the muscles in the face and the rest of the body. That's where the focalized or generalized dystonia comes from. She has basal ganglia calcification bilaterally, known as fast disease. That's part of that block in consideration. Come on, girl. We are due, literally in a week's time from now, to be going into hospital to be doing procedures, colonoscopies and endoscopies. So both ends. The critical care team are ready and waiting. It's not just a day procedure, it's a multi-day procedure, 2 days before, 2 days after, because of this sort of shit. This is how Dyan reacts: crashing, having multiple seizures, having respiratory crashes, having cardiac crashes. At the moment, you can see it's the ups and the downs and the peaks. Okay, that's what these data grabs for us accurately. The accuracy of this device has been cross-checked with medical grade equipment, and I have used this in hospital environments to check against their equipment there. It is actually approved FDA and TGA, Therapeutic Goods Administration, so we do know that it's a medical grade equipment, and we know the accuracy of the results is shown clinically. So I trust the results. I tend to use 2 or 3 different types of equipment as we go as well. You can see from the blood pressure, 101/64, heart rate is 52. Same time as it's showing 52 on her device. Hey, sweetie. I'm happy that your blood pressure is not too low. So you've got blood pressure pushing things around correctly. It's also not too high, so the pain is not crashing you out. So I feel that's good. Temperature is coming down. Oxygen stats is being a shit at the moment, 89%, as we can see here. Still getting this action here. So the eyes, the muscles that are engaged around here, facial muscles, facial neuropathy, the jaw or oromandibular, all this is part of the dystonia still going on, but that's where it will slowly come in, because that's the pain part that's helping to relax you. Yes, sweetie. I love you. Okay, the tonic seizure should be stopping now. It's okay. It's okay. Do you have any nausea? Because I can give you some more on Danzatron. No, she's indicating no to the nausea. That's good. 88% on the oxygen. There will be more conversations held with the hospital when we get a chance to do so, because I do need medicinal oxygen in a pure grade in the cylinder format to deliver high concentrates of oxygen directly. Okay, what's this? Dystonic contractural splay, right hand. Left hand is static, no engagement. Both feet are fine. So we have a contraction down the right hand side. Hopefully that'll ease out. Okay, interesting. So she's been experiencing multifocal, different focal points in the extremities, left and right hands. Nothing in the feet at this point in time. Tonic-clonic seizures can also end in a Todd's paresis, a paralysis. So I'll check those once I have some more cognizance coming around. Oxygen stats will just come back out of the 80s into the 90%, so it's 90-91. Heart rate's at 50. 6:13 p.m. It's Sunday, 18th of May. 22 degrees outside. It is 25 degrees, 0.1. Perfect temperature inside at the moment. I'll bring it down a little bit. I want it up so much because it'll increase the blood pressure because of the orthostatic intolerance. Neck indications of sore. I'm not surprised. She's got CCI, cranial cervical instability. That's why I gave her the Gabapentin. That will hopefully start to ease some of the pain around the neck and the nerves. You're in pain. I get that. Okay. I can give you some tramadol.
No.
Okay. We're limited on options. You've already had some Panadol Osteo, and you're not due for some more because it's a slow release. Panadol Osteo 665. So you could have a little bit more. You're in range. We'll be able to give you some more because you do low dose. We do micro dosing Panadol.
No.
No. Do you want some Nurofen, ibuprofen? No? CBD? I can top you up on that. That'll help with your nausea, that'll help with your muscle relaxants and help with your pain. No? Okay, it's very hard making pain decisions for Dyan. I'm just going to ease her out of the leg position because if she goes into a seizure, she will absolutely tear some of the joining ligaments and supporting joints and or dislocate. I don't really want that. Heart rate. Oxygen stats are freaking good. See, this is the ups and downs. This is the catch-22. You get one thing right, get something else wrong. Oxygen's have gone up, 97, 96. Heart rate just keeps flapping around. He can't make a decision where it wants to go at the moment. That beautiful? It is. I think you haven't had any more clonic seizures for a good 5 minutes. I'm really happy. Yay, you. We've broken status epileptus, so that part is fine. The dystonia is still having some contractions, okay? So you're going to feel a little bit funny in the face. You're going to tell me some things. Do you have any contractions in your chest or back?
No, dribbling.
Dribbling? Okay, that's fine, because your jaw's been very engaged. Do you have any sore jaw bones? Transmandibular joint, TMJs. Are they okay either side? No, I need to check inside your mouth. Your head's hurting. That's okay. This always happens after a seizure. Top of the head is seizure related. It's going to ease off, okay? I need you to drop your jaw for me. Let me have a look inside your gorgeous mouth. Now, what I'm looking for is making sure that no teeth have been moved or cracked. I'm looking to see if there's any indications of blood. Looking for any cuts, grazes that have happened over the tongue inside the lips. Okay, you're good. It's only about 35% of the cases that you'll actually cut, bite, dip tongue or cheeks in a seizure. It doesn't happen all of the time. That's heart rate dropping down at 48. I'm not stressed about the heart rate side of things, and as you've seen, we're not stressed about the other levels. We know our levels, we know our timing. This is why we have a seizure management plan. It's paramount to have a customized seizure management plan specific to the patient. What we do for Dyan is not going to be the same for other patients. Most other patients, you'll make sure you put into a recovery position. Okay, with Dyan, I can't do that because of the instability of her neck and her shoulders. Glenohumeral joint, major dislocations anterior, Hillman sac injury, she's broken bones around the actual shoulder joint. Certain things I can't put into certain positions. So I've got to be very careful to manage between lying flat back supine and then if she's having problems, aspiration, choking, breathing, then put her into recovery for drainage. Headache will ease. Okay, it'll ease. I can't give you ice, that'll cause more tics. Okay. We've got you. You've done so well. You are a little trooper. With arms that are going off this heart rate, it's just flapping a little bit at the moment. Okay, so about 48, 49. Second level thresholds are the 40s. If it sustains below the 40 for a period of time, yep, I'm on the call to get an ambulance. The oxygen, even though it's dropped down to the 70s, it wasn't sustained. It was mostly in the 80 range. We've got oxygen here, but it wasn't doing a good enough job. It's doing a job. If I didn't have it, it'll be down in the 60s and the 70s, facto. So really having medical oxygen cylinders, high grade oxygen concentration with the flow would have been a better result. We're using an oxygen concentrator that pulls air from the ambient outside temperature and actually pumps it in. It's a lower quality grade. Your lips are sore? Your lips might be what? Have you bitten them? I couldn't see any sign of biting. They could be dry. They feel funny, that's good. Cold. They do feel cold actually. You've had some struggles getting some oxygenation going on, so that might be related to that. You've had obviously the dystonia in the face, sweetie. You're going out at the moment with Syncope, 6:17 p.m. Come on. Oxygen stats are good at 97, heart rate's at 50. You know what would be useful is if we actually have a running board up the top there with an LED monitor so I can actually see your heart rate and your oxygen stats easy. That'd make my life a heck of a lot easier. They don't make my life very easy as a informal carer and having to do all this by myself. Thank you. Is that for me? I'll look after her for the moment. She has been looking after you in very close proximity, which is really good. One of our lovely subscribers, Willow from Tasmania, on the channel, sent this to Dyan for her birthday, and it is always close at hand for Dyan as a comforting feature. Dyan, because of 22q11.2 deletion syndrome and those 180, 185 plus clinical different symptoms of varying degrees includes autism, ADHD, OCD, Tourette's, multiple different seizure types, skeletal related issues, gastrointestinal problems, so she has gastroparesis in that. Instability in skeletal scoliosis, deterioration of the spine, CCI, cranial cervical instability as well, cardiac related issues. She hasn't got any congenital from birth, but they can actually occur at later onset, particularly around the aorta for patients in this area, and that's why they need continual monitoring. That's what the International Clinical Guidelines for patients in this cohort actually recommend, as well as other areas between neurology. She's seeing about 22 plus different specialists at her local hospital, and she's exhausted in the last couple of days, particularly because of going to hospital recently, to see, of all things, an ophthalmologist, the eye doctor, who basically said, look, the structures are fine, you actually need to see the neurologist because your brain ain't sending the messaging from your eyes that you see, and you're having convergence related issues, not being able to focal and concentrate on where things are going. It's affecting your walking, ataxia. He was good. He was patient, he was understanding, but he was also learning. He's another one of those doctors who, unfortunately, with most specialists, don't know anything about 22q11.2 deletion syndrome. He has to ask us. And we come prepared, we have information for him to check out, and that's why he did some extra tests. But even there, in that environment, Dyan was about to have seizures, and we're lucky able to go to a dark room, lay down on a hospital bed, and stabilise her condition. Good girl, you're coming around. So this, timing-wise, is spot on to what we expect. What I'd expect now also to see is a couple of good yawns in the next few minutes, because her body is going to start to really relax because of the medications, the emergency medications, the ASMs, anti-seizure medications that have been applied. That's going to help her body to relax, not be in pain, and hopefully stabilise some of the levels that she's going. She's going to feel tired. She'd naturally want to roll over and probably go to sleep. But at the moment, she's feeling that yuck feeling that you get post-ictal after a seizure, where it goes, what the hell just happened? What happened to my brain? Why is my body doing these sort of things? The alarms are for the heart. I'm going to bring your oxygen sats down to 2 on the machine, because you're sustaining a good 97% oxygen saturation. Heart rate's at 50. Like I said, that's a first level monitoring alerts. It's important for us to know these things. 40% or 40 beats per minute is where I go, right, we've got major issues. There's the first of the yawns. Why do we have such high predictability of these things and the behaviours? We've done this 1,000 plus times over 10 years now. We have become experts in the field for Dyan, knowing her specific condition, her seizure management plan. We have processes in place. This is why we don't rush off to ambulance. This is why we don't call crashes. This is why we don't go stressy. This is why we just follow the plan, apply the medications, monitor the symptoms, deal with the different components, whether it's subluxations or dislocations. I do need to check your feet for me though. Can you wriggle your toes for me? What's happening? You're feeling inside the top of your palate?
It's itchy.
Itchy? Let's just have a quick look, baby. It's a bit red actually. It's not as if you've bitten or anything along those sort of lines, but it certainly seemed irritated. High palates and palates in general, it's about 80% of patients with 22q are going to have some sort of palate related issue. Cleft palate is the most common around that, cleft lip. High palate may be part of that as well, some sort of midline palate related condition. That's synonymous with the condition 22q. There's a lot of commonalities. Just like the autism and ADHD. ADHD represents about 40 to 50% of the cohorts will have ADHD. 30% to 40% will have autism.
That's so nice.
Deviated septum?
No.
Oh, your filament, the distance between your nose to your lip. You've got a big gap between that. Yep, and that's a genetic footprint, a marker that people can see visibly. That will help identify, just like shapes of the ears or if ears pop out.
Like people with cleft lips.
Yeah, correct. And sometimes it could be the amount of curve in the top part of the lip, the distance between the nose and the lip, shape of the ears, or whether they pop out. Or in your case, particularly the size of your head, or microcephaly. One of the indicators I had first when I was really trying to study and work out what Dyan might have was I was measuring these components and realised that her head size was below 1% of the standard deviations for females on her cohort. And it's like, well, it was significantly multiple standard deviations below. It's like, why is it so small? And that was helping me to lead with some of the genetic information I found towards further testing at Genetic Services WA to finally get a diagnosis only 2 years ago. 2 years ago, for 48 years, Dyan has presented thousands of times to hospital with all the symptoms that actually 22q exactly describes. So you could actually take the clinical guidelines for 22q and look at every one of these items that a person might have, and then you go, that's what Dyan's got. They diagnose you with so many separate things. And some of those are multiple rare conditions as well in their own right. Ehlers-Danlos, a high connective tissue disorder, 13 different subtypes. Dyan's got that, which is very, very flexible. The Fast disease is also a rare neurological condition, or the basal ganglia. Chest pain?
No.
No? I'm going to take your blood pressure, boo, because your heart rate is doing good at the moment at 54, which I'm happy with. Oxygen stats has sustained nicely. Second of the major yawns, her body stage really relaxed. Yay! Was it your third? Was I miscounting? Oh my goodness me. People at home can tell me that I've miscounted.
Really good.
You did really good. You're such a tough cookie.
Check my blood pressure.
Can I check your blood pressure?
My chest is tight.
Your chest is tight. I can check that first and see where your levels are. We might have to give you some more GTN spray. Basal constriction. And we can actually stop that with spray. Let's have a look. Let's check. We've also got to be careful of any cardiac arrest. For females, that can occur quite easily and not quite the same symptoms that a male might get. Another one of the big yawns. Oh, she's pumping out those yawns. Her body's really relaxing nicely from the use of the emergency medications. I know you don't like the plastic tube in your nose. I'm going to be able to take that out soon because you're stabilised at 97. I'm going to reduce your rate down to a level 1.
You smell of the plastic in my nose.
Yeah, I get that. Your oxygen dropped straight away by doing that to 94, so I'm going to keep it at a level 2 and keep the levels right. This is why we have these indications and pulse oximetry, so we can see exactly what's going on and deliver the right dosage to make sure things are going well.
I'm meant to have dinner. This isn't help.
You're meant to have some dinner. I know, right? You are due for some food, miss.
I'm meant to be eating my dinner.
Well, your blood pressure is consistent at the moment. It's at 101/64. Heart rate is at 54. I am happy with the consistency. I expect that because your head is tilted up, so that's going to affect by about 5 to 10 basal points the mg levels. Well, at the moment, I'm going to keep it on a little bit longer because I haven't got that totally stabilised. You're still flapping with your oxygen, so we're not going to rush it. There are two different types of hypnobil midazolam that we use. Hey, Papa? Tomorrow is going to be a much better day. This version in the softy tube is a lot easier to rip and squeeze straight away and deliver, which is something I actually prefer. It is huge. It's 5 milligrams per minute. These ones in the glass little ampules are a bit more of a pain because you've got to actually break the ampules open than they are glass. Some people like to use the glass breakers to actually pop them out, so they're useful, and then have to use a syringe. We use that. That is a snap-it. That is a device that's used on the glass ampules. You put the head of the ampule in here, you snap the actual ampule, and then you draw it in the actual syringe to deliver it buccal down the side of your jawline inside your mouth. So all that does is like a handle to hold it. Yep, just like an aluminium tube. You place it in here. All right.
I didn't know we had something.
I know. All the crazy stuff that I buy. Things I find on eBay. I know, right? No, it's not like a little miniature periscope, and it's not going into your miniature collections. It's not a Canon either. You give that back here. She loves her miniatures. you can't have it. It's the only one I've got. Actually, I should get another one since they are quite useful. Look, you can break the glass, but some people find it a bit of a struggle, and when you're flapping around and trying to do many other things, it's sometimes easier to do things accurately. You don't want to spill medication. You want to be able to deliver it accurately and give the correct dosage. Oh, it's the baby got it now. It looks like a lightsaber, really, for his size, you know. That's a very Star Wars-esque thing. Use the Force, Luke. How are you feeling, Possum? Can I do a quick little couple of checks of the face and everything? So the stuff I put in your mouth is midazolam.
So much liquid.
Yep, it's 5 mils. It feels like a lot, but it's the same delivery that we use every time.
I don't remember it.
Mm-hmm.
I don't remember it.
Yeah, that's the one that we use, sweetie.
I don't remember that.
Stabilisation, we've got oxygen stats currently at 93. Still a bit of flapping going on, so that's why we're keeping the oxygen concentration going.
What
Heart rate stabilised at 53, but we haven't had any more tonic clonic seizures, so the midazolam's done this thing. The dystonia seems to have settled down. Just wriggle your fingers for me, show you got full range of motion. Lovely. Other hand, play the piano for me. Cool. And your toes are okay as well? Lovely. That's what I like to see. All right. Yeah, careful those muscles. Quick little face check for me. Can you poke your tongue out for me? Good girl. Nicely. Bring that back in. Can you show me your happy face? Big smile. All right. And show me your shock face as if someone scared you. Boo. Okay, so we've actually got non-lateral movement. So on the shock face, you actually see that the left is actually extenuating downwards, the right is actually staying in position. So it's not equal both sides. In the smile face, we're not actually engaging the eye muscles at all during that activity. So that's part of the blepharospasm. So we're still having some dystonia static, maybe some neuropathy of palsy coming through. So we have to wait for that to dissipate like an ice block melting. But those parts will come back to you. Are you feeling tired? How's the nausea going? Gone. Yes, your jaw muscles, your transmandibular joint, where the bones of the jaw meet. Okay, can you check for me to see if your jaw is out? Do you have overbite or underbite?
A bit up on these.
Okay, so you bit up on the other things. Just do a little wiggle of your jaw side to side gently in an open position. Just gentle, you don't want to push it because it will hurt those muscles. So I see that they're relaxing and engaging, okay? Any clicks?
So weird.
Okay, it looks even at the moment. Good girl, just take your hand away from your face. So Dyan's just working the lower mandible at the moment and just clicking in with the transmandibular joint just to try and make sure that there's movement.
I don't want to dislocate it.
I know, and you, with the jaw thrusting and oromandibular engagement, you do, and quite commonly will have subluxations or full dislocations of the joint. So it tenses up, it causes a lot of soreness. You can gently rub those muscles up the top of the cheek if you like, sweetie, just with both hands. That's it, just in that space where it might hurt the most. Another big good yawn, nice and relaxing, really good. You have done so super duper well.
No, I failed.
No, you did not fail anything. You did 2 things today, which is a big thing for you.
3, to clean up my.
You're doing some online YouTube cleaning. You're doing some of that. That's exhausting in its own right. People don't understand that even just being a YouTuber takes a lot of a toll on Dyan. And this is about the pacing. Pacing is not just being in bed. If you're mentally doing things, I know you love the people out there, your audience, and that's fantastic. But you have to be also cautious about pacing. There's rules around this for you, not only for your fatigue in general, but it affects overall your condition, respiration, heart rate. I know, you're trying to live once. YOLO. You only live once, you're living your best life. We should go to Nangamil, we should go camping. Well, hopefully, one day soon we'll be able to do that once I feel things are stabilised. Well, you know what? We've got this already on a battery, which is really, really cool. You need a generator. Well, I actually think I need to check the power point because I can see the battery on this unit going down at the moment. I want to know why it's actually doing that.
I want a generator. I think I live on grid sometime.
You want to live off grid sometime?
I want to be in the dirt.
You want to be in the dirt. Well, I'm going to have to check that power point because for some reason the percentage is going down. I have a spare battery on the other side for the device.
Coffee in front of a river.
That would be very nice. Well, very soon we'll do that. How about that? After the procedure, that'll be our treat. We'll go for a one-night camping and have some fun. We've got a swag, but I'll have to take lots of things with us that we can do and look after you just in case.
I don't have a generator.
We'll work on that. How does that sound? That is heart rate just dropping down. Oxygen has remained very good. I'm going to actually take you off oxygen.
Yay. My chest is tight still.
Your chest is tight still. Okay, I'm happy to give you another GTN. It'll give you a bit of a headache for a short space of time. No?
Ow,
I'm sorry, it's not a nice sensation, but you need the oxygen, don't you? So as I was saying about the pacing and obviously Dyan being on YouTube, And some people ask us, you know, can I message you? Can I phone you? Can I do a video chat? Can we meet up?
I would love
She would love
to,
to,
but
absolutely. But the reality is, we have to actually pace Dyan very carefully. There's certain
maybe
things,
one day.
maybe, but some things are also out of Dyan's capability. She struggles for telephones, full stop. She hasn't done telephones for a long, long time. It's that
I've
two-way
never
communication,
done it.
executive functioning, auditory processing, all these autistic things that she finds incredibly difficult to manage. She
Oh.
struggles. Even video conferencing, she finds it difficult with turn taking, cognitively to be able to hold the conversation, ADHD going off on other tangents, Tourette's kicking in. It is a challenge overall. Whew, the alcohol wipe is strong.
I don't know.
Goodness me, the vodka's strong on this one.
I don't know what to say.
You don't all the time, do you? Oxygen stats are stable, 96%. Heart rate is doing well at 52.
And autism,
Yeah.
it's like you want your people
Yeah.
around, but you can't always engage socially because
No.
we're not
It's you.
interested, but not because we don't find see people bad. It's just we need to just be alone, otherwise
Yeah.
we get overloaded.
It is overloading. It's a sensory overload, psychosocial hangover. It's currently 6:35 p.m. 21 degrees outside, 24.9 degrees inside. So the room temperature is spot on where we like it to be. Oxygen stats for Dyan is 96%. Heart rate's 55. She's doing really, really well. She's recovered and broken this spell of status epileptus. The dystonia seems to have left the building. She's wanting to sit up a little bit more comfortably.
I was looking forward to my pumpkin soup.
No, I'm sure you will. And you know what? Very soon you can still have that if we can get this swallowing action and the dystonia release. And can you pass me the sick bag and the towel from that side for me? I don't want to reach across
The
here.
towel's dirty.
The towel will be going into the wash. That's not a problem.
spat
And
on
sick
it.
bag, you spat on it. Oh my goodness
I
me.
had to swallow that weird stuff.
That medication, I'm sorry.
I
Get him.
don't remember that, so yeah.
Yeah. Well, I'm glad, and look, we have obviously got the helmet ready to go as well, but I'm glad that we haven't had to apply that in this case.
Oh,
What's wrong?
the pretty
The pretty
scarf.
scarf, yeah.
Look at
Dyan's levels are all stabilised at the moment. She's off the oxygen concentration. She's maintaining 96% oxygen. Heart rate's at 56%. She's doing really well. So we've come out of that episode of multiple seizures, tonic-clonic seizures. We've broken status epileptus by applying ASM's anti-seizure
I
medication.
watch the movie Groundhog.
You look like a pirate. Arr, to be
No.
sure.
No, I want to watch the movie.
Oh, groundhogs. Okay, I see where
And
that
I
came
wanna
from.
Go with the dudes.
Yeah,
And
on the
I want-
bikes, on the
And
hogs.
I want my own motorbike.
You want your that would be interesting to see you drive a motorbike.
And
ride a
Zara's
motorbike?
coming with me.
Zara's coming with you. Okay, sounds good. She's going to be your pillion passenger, is she? On your hog. Sounds good to me. No, you're going to have to slowly recover, okay? Slowly, only recover, please. So gentle on that
But
side of
I
things.
prefer a beanie on it.
Well, in winter mode, a beanie would be quite nice to keep the top of your head warm, but when you're hot and you're having to thermoregulate, you need to keep cool with things. Deal? So we'll keep a balance point behind all that. Guys, thank you for being around. Appreciate you sticking around for this very long episode and crashing all over the shop. Now remember, we're not medical professionals to be able to give you advice that's specific to your needs. That's what your primary care physician is for, your own GP or specialist. Go and see them. If you have problems in any of these sort of areas, book an appointment, go and see them, have a chat and talk to them. We're here to educate and advocate for Dyan, a patient with 22q, and to explain what the condition is and any of her rare genetic conditions and how they all work cohesively together. How I, as a home informal carer, look after Dyan. We're a married couple. Dyan is 50 years of age.
51.
Testing her neurology, she's 51. Good girl. And how old am I?
You're turning 55.
When's that?
Oh, tomorrow?
Tomorrow. Yes, I turn 55 tomorrow is my
We
birthday.
have to blow balloons and stuff.
I don't think you're going to have any puff to blow up balloons, young lady.
You-
I'll be blowing up my own balloons. I will be,
I
indeed.
need two.
Only two? Okay, I'll blow up 2 balloons for myself.
Max likes
I know, Max the cat. Max the ragdoll absolutely does love them. And the streamers, doesn't he? Indeed. Guys, big thumbs up of encouragement for Dyan because she has done exceptionally well to get through that. Hopefully this is showing you through education processes to see what we do, our seizure management plan, the process of emergency medications. Remember, the information that is addressed here is specific to Dyan and not relatable to yourself. That's what your own specialists are for. If you're new to the channel, welcome. Don't forget to subscribe and hit that notification bell. If you've got comments, questions, ideas and suggestions, we'd love to hear from you. Tell us where you are. Drop a flag in the comment as well. It helps us to understand what country that you're on. And if you have any of these similar conditions, share a bit about yourself as well. Thank you so much for sticking around and the support, love, and the help that you provide. Don't forget to share our channel so that others can find out too. Bye for now.